Alright, supporting systems and movement in animals, types of skeletons. There's hydrostatic skeletons, exoskeletons, and endoskeletons. Hydrostatic skeletons are fluid-filled, closed chambers within an organism. Exoskeletons surround the body of an organism. Endoskeletons occur within the body of an organism. Hydrostatic skeleton. So, hydrostatic skeletons are fluid-filled, closed chambers inside the body that provide support against which muscles can contract to bring about movement. Helps to cushion parts, internal parts of from shock. Occur in soft bodies, invertebrates such as coleotrites, for example, jellyfish, annelids, for example, earthworms, and nematoids, for example, roundworms.
Okay, how do these animals move? Contracting the muscles surrounding the fluid-filled cavity creates pressure which changes the shape of the animal. This result this results in movements such as swimming, burrowing, and crawling. Jellyfish, for example, move by contracting their bell-shaped form. Earthworms, however, change their body shape via peristalsis. Circular and longitudinal muscle produce movement through waves of contraction and relaxation. Chitae, or bristles, press into the ground, ensuring the forward movement. So, the disadvantage of hydroskeletons: they lack well developed skeletal defense mechanisms, they have restricted range of movement, they are confined to areas near or in water as they lose water readily and cannot reach great size.
Okay, so exoskeletons. Uh, Arthropods form the main group of animals that have exoskeletons. In arthropods, the skeleton is made up of chitin, which is light and quite strong. Advantages and disadvantages of exoskeleton. So the advantages is that external structure that supports the animal and protects its internal organs. It has muscles attached to knobs and plates allowing movement. It has joints where the exoskeleton is thin and flexible, allowing the animal to move more easily. Often covered with a wax cuticle, reducing water loss from the body and preventing the animal from drying out. The disadvantages include limited mobility and limits growth. Is a large animal would need a large exoskeleton, which would be heavy and restrict movement.
Hmm. So, overcoming the disadvantages. Growth limitations are overcome in the following ways. Arthropods shed their skeleton, which enables them to grow. This is known as molting or ecdysis. A new skeleton is regenerated by the underlying epidermis. After the exoskeleton is shed, the arthropods pump up its body by the intake of air or water to expand the exoskeleton to a larger size. Dehydration of the cuticle then takes place, which causes it to harden into an exoskeleton. Movement limitations can be overcome by allowing flexibility in the following way. The arthropod skeleton is divided into different functional units, for example, the head, thorax, and abdomen of insects. Arthropods have jointed limbs where the exoskeleton is thin at the joints, enabling the leg to move.
Mm-mm-mm. So, endoskeletons. They are found within the body of an animal. All vertebrates have an endoskeleton. Some, however, such as turtles and tortoises, have an exoskeleton. Vertebrate skeletons are made up of either bones and or cartilage. So the advantages of endoskeletons. This includes supports the body, giving it shape, made up of living tissue that can grow as the animal increases in size, protects the internal organs such as the brain, lungs, and heart, and provides anchors for muscles which can work with bones to allow movement.
Mm. And then tissues that make up an endoskeleton. So you have cartilage and bone. There are three types of cartilage. They are hyaline cartilage, elastic cartilage, and fibrocartilage. So cartilage occurs Jesus occurs in isolated areas in the body, For example, the ribs, nose, pinna of the ear, between vertebrae and lining of joints. Softer than bone because it contains less minerals. It has few blood vessels and no nerves. Importance of cartilage. Lines many joints, facilitating smooth movement. Acts as a shock absorber between vertebrae and forms a flexible structure such as the epiglottis and the pinna of the ear.
So, how is cartilage made up? There are three types of cartilage: hyaline, elastic, and fibrous cartilage. All three have the same basic components. Chondrocytes are mature cartilage cells in lacunae, which is cavities, surrounded by matrix made up of jelly-like substance in which collagen fibers, for example, flexibility and strength, and elastic fibers for elasticity are deposited. A large amount of tissue fluid. Bone. Bone tissue is made up of the bulk of the skeleton. Hardest tissue in the body, but it needs to be as light as possible to reduce the weight that an animal must move about. Bone tissue is supplied bone vessels, nerves, and lymph vessels.
Hmm. And then, how is bone tissue made up? Bone tissue is made up of osteocytes in lacunae set in a matrix made of the following: collage fibers that stick to each other in a crisscross pattern, giving bone its flexibility, making it strong and durable. They have a glistening white appearance and are aka white fibers. Minerals, including calcium salts, incorporated in the matrix via mineralization, which accounts for the extreme hardness of the bone. Then bone tissue classification. So there's compact bone and spongy bones. Compact bones give strength and support to the body, while spongy bone helps the skeleton resist stress and produce red and white blood cells.
Okay, so compact bone. They are found on the surface of bones and the shafts of limb bones. They are very hard and dense and look smooth and homogeneous. They are made up of many Heviasian systems or osteons. They provide strength and support to the body. Spongy bone, calcareous bone. So, light in weight. They are made up of thin plates of bone called trabeculae, which form an irregular network. Able to resist stress as the plates of trabecula are precisely arranged along the lines of stress. They're able to form red and white blood cells in the red narrow found in the spaces between the trabecula.
Mm. And then there are bone classifications such as long bones, short bones, flat bones, and irregular bones. So, long bones, these bones are much longer than they are wide. They are made up of a shaft, the diaphysis, and two heads, the epiphysis. All the all the bone on the limbs are long bones, except the patella and the bones of the wrist and ankles. The functions are: these bones provide support for the limbs and for the attachment of muscles, enabling limbs to bring about movement.
Okay, that's a cool looking picture. Anyways, short bones. Cube shaped bones which are nearly equal in length and width. They are made up of spongy bone except at the surface where there's a thin layer of compact bone. Examples include carpals of the wrist and tarsals of the ankles. The functions. So, these bones enable the wrists and ankles rotate and move in many directions. Flat bones. They are thin, flatted, and slightly curved bones. They consist of two parallel layers of compact bone with a layers of spongy bone between. The function. protect parts of the of the body and provide large areas for the attachment of muscles. Examples include cranial bones, the sternum, which is the breastbone, ribs, and scapula.
And then irregular bones. These bones do the bones that do not fit into any of the other three classes. Complicated shapes and mainly made up of spongy bone enclosed by a thin layer of compact bone. Examples are vertebrae and hip bones, um, bone injuries. There are three types of bone injuries, and they are bone fracture, is a break or crack in a bone. Then a stress fracture is a small crack in a bone as a result of repeated pressure on it due to prolonged activity such as walking and running. And then fracture is incomplete break of the bone. As the bone bends, it cracks on one side, commonly in children because their bones are softer.
So, causes of fractures. Fractures occur when a bone cannot withstand the physical force exerted on it. Uh, Injuries from falls, sport or vehicle accidents, physical abuse, and disease that weaken the bone, just three examples. So, describing different fractures. They are complete, incomplete green stick, simple fracture, compound or open fracture, and comminuted fracture. So, complete. The bone has broken into two pieces. Incomplete green stick is when the bone cracks but does not break. Simple fracture is the bone breaks cleanly but does not penetrate the skin. Compound or open fracture is when the bone ends of a bone stick through the skin. Comminuted fracture is the bone fragments into many different pieces.
Mm. And then must I go over the picture?
Nah, just look at it for 2 seconds. 1, 2. Nice, guys.
Right. And then treatment for fractures, stress fracture. Usually only needs rest, ice packs, anti-inflammatories, and to stop doing the activity that caused the injury. Broken bone, you need to have an X-ray to see the type of fracture. Broken pieces might need to be put back, and both bone must be immobilized by a cast or pins until they heal, as the new bone forms around the break. And then human skeleton. The functions are for support, protection, movement, blood cells, mineral salts, and hearing. For support, it keeps the body upright and keeps its shape. For protection, for the internal organs and tissues of the body. For movement, by the muscles that are attached to the bones. Blood cells, formed in the red marrow of bones. Mineral salts, calcium and phosphates form part of the bones and are stored in them. And then hearing, ossicles in the middle ear transmit sound waves to the inner ear.
Okay, so human skeleton. I'll go with this one. So at the top, there's the cranium. There's the jawbone. Right there by the shoulder is the clavicle. By the armpit is the scapula. By the chest is the sternum. The rib cage is obviously by the ribs. The humerus is by the long part of your arm. The spine is the spine. The pelvis is by your hips. And by your lower arm is the ulna and the radius. And then on the right side, the carpals is by your hand. Metacarpals is by the fingers. Phalange is the long part of the leg, which is also the femur. Patella is by the knee. Fibula is right underneath the knee. Tibia is beneath that. Tarsals is by like the ankle. Metatarsals is by the foot, and phalange is the toes. So, makeup of skeleton. It consists of 206 bones divided into two divisions. 207 when I say you. Axial skeletons, made up of the skull, the vertebral column, and rib cage and sternum. Appendicular skeleton is made up of upper and lower body limbs and the limb girdles, which attach the limbs to the axial skeleton.
Cool picture. So axial skeleton, it is central support for the body. Protects organs such as the brain, spinal cord, and the organs in the thorax. They are made up of three regions: the skull, the vertebral column, the spine, and the bony thorax, which is the rib cage and sternum. Structure of a skull consists mostly of bones, of flat bones, which are immovable, joined together. The mandible, which is the lower jaw, is the only exception because it can move. The skull is formed by two sets of bones. You have your cranial bones, which forms the cranium, and your facial bones. Cool picture.
Nice, guys. So, do we need to know the exact parts of the skull?
Yeah, I think so. Yeah.
Fuck me. Cranial bones. Cranium equals 8 flat bones. They have immovable fibrous joints between the bones equals sutures. Bones are thin and strong to protect the bone. At birth, membrane-filled spaces called fontanelles exist between the bones of the cranium. Fontanelles allow the baby's head to be slightly compressed during birth, the size of the brain to grow rapidly during infancy. Damn. Functions of the cranium. It protects the brain, protects the sense organs, and provides attachments for muscles of the head. That's the underneath of the skull by the picture.
Mm. Okay. And then facial bones. There are 14 bones that are mainly paired. So functions are to form structure of face, protect the sense organs, provide passage for food and air, provide attachment for facial muscles, and secure teeth. The structure of the vertebral column. It is strong and flexible, consists of 33 small bones, the vertebrae. Vertebrae are held in place by ligaments that allow some movement but prevent dislocation. The vertebral column surrounds the spinal cord, which is made up of nervous tissue. My bad. The spinal cord connects the brain to the rest of the body. The intervertebral disc occur between vertebrae. There is a jelly-like sensor covered by cartilage. It acts as shock absorbers during physical activity, allowing spine to flex and extend.
Nice, guys. So, functions of the vertebral column. It supports the head, encloses and protects spinal cord, serves as a point of attachment for the ribs, allows spinal nerves to pass through the opening between vertebrae, serves as a point of attachment for the muscles of the back. S-shaped, absorbs jolts and aids in balance. So, can the vertebral column bend? Each joint allows for a small amount of movement. As a unit, though they allow a greater degree of movement, such as bending forwards, backwards, sideways, and rotating. Backbone has 4 curves, forming an S shape. This is important and helps to strengthen the backbone, balance the body, and absorbs jolts during movement.
And then spinal injuries. You have a slipped disc. The backbone can be damaged by too much pressure. The outer cartilage of a disc may rupture. The soft inner sensor bulges out, called a slip disc. The bulging disc may press on the spinal cord or spinal nerves. And then symptoms are severe pain and numbness in the limbs. Treatment may include rest, traction, anti-inflammatory medication, painkillers, and surgery if damage is severe. Then paralysis. Injuries can crush or dislocate vertebrae. This may damage or break the spinal cord. The damaged nerves cannot send impulses to muscles and organs. Without nerve impulses, muscles cannot function. Paralysis occurs. There are two types of paralysis: quadriplegic, which damage in the cervical neck region, paralysis of the whole body below the neck, and then paraplegic, which is damage in the lumbar region or paralysis of the legs. Nerve tissues cannot regenerate. Many patients may need to use wheelchairs permanently. Prevention of backache.
Am I reading this?
Yeah,
Yeah.
bro.
Okay, so prevention of backache. Good posture reduces strain on the back and muscles. Backache is very common. 80% of adults experience it at some point. 20% are permanently affected. The causes of backache include modern lifestyles involve long hours sitting at desks, using computers, watching television. Humans were originally adapted for walking, running, and active lifestyle, 2 to 4 hours daily. How to prevent backache? Maintain good posture, avoid activities that place strain on the back, and use correct techniques during daily activities such as lifting and carrying objects. So, structure of the bony thorax. So, the thorax is the whole chest. Bony thorax is a framework formed by the sternum in the front, the ribs and the cartilage on the sides, and the thor- thoracic vertebrae.
Yeah. And then structure of the ribs. So the ribs have 12 pairs of flat curved bones. They are extended from the thoracic vertebrae to the sternum. They are types of ribs. They are true ribs, which is the first 7 pairs. It is attached directly to the sternum by a flexible cartilage. Then false ribs is the next 3 pairs. They are attached to the rib above by cartilage. Then floating ribs, which is the last 2 pairs. It is attached only by the vertebral column. And then intercostal muscles occurs between the ribs. External intercostal muscles contract rib cage. Rib cage moves upwards and outwards, causes inhalation, which is breathing in, and then internal intercostal muscles, which help force air out the lungs. It is active during coughing and sneezing. Assists in forced exhalation.
So I'm going to read this last slide, then we're going to take a break.
Sure.
So, bony thorax protects organs in the thoracic cavity, which includes the lungs, heart, and major blood vessels. Supports shoulder girdles and the upper limbs. It provides attachment joint points for muscles, which includes the back, chest, and shoulders, and assists in breathing. All right. So how long is our break going to last?